uplifts the soul. Follow JustCom PH on Spotify and JustCom Music on YouTube. We are also on iTunes and Deezer.
The hottest tracks from this side of the globe. This is Amplify Asia on Radyo Katipunan 87.9 FM.
Mga Katipuneros, it's time to level up! Your talk variety program showcasing the best in media and other fields. As we feature the most loved personalities and the best practices of what we truly refer to as Magis. Together with multi-awarded multimedia guru Mr. Noel Ferrer, let's all level up every Friday from 3 to 6 p.m. here on Radyo Katipunan 87.9 FM.
Oh! Louis Gaspare! Louis Gaspare! Louis Gaspare! Louis Gaspare! Ready? 1, 2! B-L-U-E-E-A-G-L-E Blue Eagle! Blue Eagle! Blue Eagle today!
Radyo Katipunan is now online. See our live feed on facebook.com/Radyo Katipunan. Check out our Instagram and our Twitter at Radyo Katipunan and subscribe to our YouTube channel at Radyo Katipunan FM for more exclusive content.
Katipunan, Radyo, 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 Katipunan. Radyo, 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 Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagpapalitang tumpak at damo. Sa labas ng eskwela, ibibida the voice of the Blue Eagle, the voice of the Blue Eagle.
Tawag ni Ignacio, Katipunero, sugat por todos at tayo, tulo at tulo. Ipag na lumigil, hindi na bigil.
Blue and white, Monday fly. Radyo, 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 the voice of the Blue Eagle, the voice of the Blue Eagle.
Katipunan.
Coming up next, Cura, Conversations on Care, Health, and Healing on Radyo Katipunan 87.9 FM.
Radyo, 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 Katipunan, Radyo, Katipunan, Radyo, Katipunan, Radyo, 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 Katipunan, Radyo, 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 Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay at tenista, sa loob sa labas ng eskwela, ating ibibida lahat ng kwela. Radyo, 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 Katipunan, Radyo, 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 Katipunan, Radyo, Radyo, Katipunan, Radyo, Katipunan. Kawal ni Ignacio, Katipunero, sugod, todo sa kayod, dunong at tulog, lipat na
health isn't just about medicine.
It's about care
Community and conversation.
That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on
Radyo Katipunan 87.9 FM. Cura, your campus health companion where care meets conversation.
Magandang gabi, Ateneo, and welcome back to Cura, Conversations on Care, Health, and Healing. I'm Dr. Tipi Sumpayco Tanchanco, and I'm flying solo tonight kasi po si Doc Jello ay nag-field work. So, hi Doc Jello, sana okay ka dyan. So, tonight po, we're going to talk about a feeling that every single one of us can relate to. And we are going to talk about being tired. So, it's not just yung I had a long day kind of tired, but that deep, persistent exhaustion where you wake up and you're already counting the hours until you can sleep again. Naramdaman nyo na po ba yun? Meron ako talagang mga days na parang ganun po yung nararamdaman ko, no? And a lot of times, may kasabay pa to na parang ang sakit ng katawan ko, masakit yung ulo ko, maraming mga sumasakit-sakit din. So, in our fast-paced, high-stress world, running on empty is almost the new normal. Sabi nga po nila, parang epidemic na nga rin po ito. And a lot of times, sa mga pasyente natin, no, naririnig po natin to, they feel exhausted, tapos pupunta sila sa doktor nila, magpapa-blood work sila, tapos pagbalik ng results, ano nakalagay? Normal pa lahat ng lab tests nila. So, minsan napapaisip ka talaga, if I'm healthy on paper, why do I feel this bad? Why do I feel so terrible? And yun po yung huge gap in our healthcare experience. So, tonight, we are going to dig deeper. We're going to talk about chronic fatigue. Yan po ang topic natin ngayong gabi, no? At kasabay po nun, medyo magiging mga geeks po tayo. Pag-uusapan din natin yung mga cells natin, lalong-lalo na yung tinatawag natin na mitochondria, and how a functional medicine approach might hold the answers to getting that spark back, that energy back. And para po tulungan tayo ngayong gabi, kasi nga po wala si Doc Jello, to help us unpack that complex topic, we have a guest whose expertise bridges that gap between conventional medicine and holistic healing. She is a board-certified specialist in internal medicine with a background in molecular biology. But, hindi po siya nag-stop doon. Hindi lang hanggang IM yung specialization niya, no? She evolved her practice to look at that bigger picture of health. And she is actually one of the very few fully certified functional medicine practitioners in the Philippines and Southeast Asia. So, mag-hello po tayo sa ating guest. Let's welcome Dr. Denise Lavilles. Hi, Doc Den!
Hello, and thank you for the warm welcome, Dr. P. Magandang gabi sa inyong lahat, to all our audience. To our audience, hello!
Ayan, okay. Hawak na ni Doc Den
Hawak
yung
ko
mic
na.
niya. Ayan. Na-excite po si Doc Den, pero yan, may mic na. Maririnig na po natin siya. So, alam niyo po, si Doc Den is also our clinical faculty sa Ateneo School of Medicine and Public Health. And kung halimbawa, nag-wonder kayo, where can I find her? Mahanap niyo po siya sa Wellness Center at ano pa ba to? Sa Institute for Cellular and Molecular Therapies sa Medical City. Tama ba yun, Doc Den?
Yes. Oo.
Ayan. Okay, pero bago po tayo mag-start, kagaya ng ating tanong sa ating mga guests every time, Doc Den, kwento muna tayo. Kwentuhan mo kami. Paano ka ba nag-start dito sa journey mo ng IM, tapos tuloy-tuloy hanggang functional medicine?
Actually, okay na dapat ako sa IM lang eh. Sa IM. Sa internal medicine. So, after graduating from internal medicine and I started seeing patients at the clinic, yung napansin ko kasi, maraming mga pasyente na paulit-ulit pa rin yung mga concerns nila kahit na nagre-reset ako ng gamot. So, for me, I felt like I needed to explore more ways that I can help my patients. Kasi like, kunwari, yung pasyente na yung concern nila is always high cholesterols, di ba? Yun actually yung trigger patient na yun yung
Tandang-tanda
Oo,
mo
tandang-tanda
pa.
ko talaga
Oo.
yung pasyente yun. Parang pang-5 bisita na niya sa akin sa clinic. Tapos, sobrang bait ng patient, yung sobrang masunurin, nagpapagawa ng labs, pagsasabihan mo, iinumin yung gamot na nireseta mo. Pero, parati pa rin tumataas yung cholesterol niya or parang hindi masyadong nagno-normalize. So, I found myself repeating the same things over and over. Tapos parang inisip ko, parang mali yun. Parang dapat meron pa sigurong ibang ways
Meron pa bang
of
pwedeng
helping.
gawin? Oo.
So that's how I found myself in functional medicine.
And then,
Tapos
oo.
kasi dun sa wellness center, maraming mga patients I see who go through their executive checkups, and you wouldn't say that they're not sick. I mean, they're not sick.
Oo.
Diba? They're well. Pero they have all sorts of concerns. Like sabihin nila, Doc, paano ba ako makatulog ng mas mahimbing? Or bakit ako parating pagod? Pero normal yung mga labs.
Oo.
So parang for me, meron talagang mga gaps.
Right. So, ang ganda, Doc, din, nung narinig ko yung sinabi mo, no? So, unang-una, yung pagtatanong mo na, meron pa ba akong pwedeng gawin para dito sa mga pasyente ko? Parang, that's so Ignatian, magis, di ba? Meron pa ba? Pero, sinabi mo rin na marami kang pasyente na parang laging pagod kahit normal yung labs nila. So, we can actually refer to this as parang chronic fatigue siguro,
yes,
no?
oo.
Pwede mo bang explain sa amin, ano nga ba tong chronic fatigue or chronic fatigue syndrome na naririnig natin ngayon?
Okay. Typically, yung chronic fatigue syndrome, they call it a wastebasket diagnosis kasi parang yun, wala kang makikita typically na abnormal sa mga labs or yung mga obvious na reasons for disease.
Right.
No, and sometimes, some patients will ask me, Doc, is it true that it's really just all in my head?
Oo, guni-guni ko lang
Guni-guni
ba
ko lang ba
yun?
to, Doc?
Oo.
Ganyan. Pero, yung chronic fatigue syndrome kasi, it's a different kind of tiredness. Di ba? Normal naman for all of us to experience some sort of tiredness if we're puyat,
Right.
or if we're busy. Pero ito kasing klaseng chronic fatigue syndrome na to, it's a very pervading kind of exhaustion na it can last for months and then
So,
it
tuloy-tuloy
starts
siya.
affecting yung quality of life ng patient, yung mood niya, yung functionality niya.
Right.
So, yun. Tapos, magkakaroon na siya ng iba-ibang mga associations. Like yung sabi mo, di ba? Yung
Mga symptoms
Oo.
na nararamdaman, no? Doc, then, pero ang tanong ko, di ba kasi yung iba maririnig mo, parang na-burn out ako. So, pareho ba tong chronic fatigue with being burnt out or stress? Pareho ba to?
I would say meron siyang relationship. Sometimes the environment of chronic stress is what actually leads to the chronic fatigue syndrome. Tapos pag sinabi mong stress, ang dami kasing klaseng stress niyan eh. Merong physical stress. Like kunwari, exposed ka ba to a lot of pollution or noise? Or are you eating enough nutrients to fuel your body properly? It could be an emotional kind of stress or a mental kind of stress, financial stress. So parang there are all sorts of stresses.
Nako, ang dami pala.
Marami siya.
Ang dami nga stress pati. Uy, malapit na po ang sweldo. Aabot ba yung budget ko hanggang sweldo? That can cause stress din, ano? So, Doc, then actually, mga sinasabi mo, ito yung mga possible causes din of chronic fatigue, no? So, sinabi mo nga stress, iba-ibang klaseng stress. Meron ka pa bang, like, usually, ano ba yung rank? Ito yung top reason bakit nagkakaroon ng chronic fatigue itong mga pasyente na nakikita mo.
I wouldn't say that there was like one top reason. Usually kasi kaya nagkakaroon ng chronic fatigue syndrome, it's multiple factors all trying to assert themselves, and so it gets overwhelming for the patient.
Right.
So, yun. Oo, ganun
Sige.
siya.
So, pero Doc din, di ba sabi mo kasi kanina, ang chronic fatigue syndrome, parang waste basket diagnosis. Ibig sabihin, parang na-work up na sila, na-examine na ng doktor, wala talagang makitang dahilan kung bakit sila pagod pa rin, ano? Pero, maaari bang warning sign to ng something that's more scary or yung mas malaki yung impact sa health?
Oo, pwede rin. Kasi lahat naman tayo, the way that we present no, in terms of health, spectrum parati yan. So, where we are in our health is always a product of our genetics, our lifestyle, our environment. Tapos, pwedeng nandun ka pa lang sa stage na may symptoms ka pa lang, pero wala pang nakikita sa paper, sa labs. Meron namang mga patients na you catch them, sobrang dami na nilang mga organ and tissue injuries or damage. Meron namang iba, yun nga, yung parang meron pa lang silang mga risk factors. Like kunwari may hereditary predisposition or maybe something happened while they were during childhood that might actually set them up for disease later.
So, pwede pala yun, Doc?
Parang spectrum kasi
mula
yan.
bata. So, importante talaga mula bata pa lang we take care of
Alagang-alaga
the
ka
health
na. Oo. Tapos lalo na pati like yun, I'm sure ikaw, Doc, di ba? You're a developmental pediatrician. So, big deal yung parang taking care of that maternal environment, di ba? While the baby is still forming in the
right.
womb.
So, mula conception pa lang, pwedeng, kumbaga, setting them up for fatigue na later on. Pwede pala yun, Doc.
Merong ganon, oo.
Right, opo. So, maganda yung sinabi ni Doc Den. Doc Den, di ba, molecular bio din ang iyong ang background. So, siguro pag-usapan naman natin, di ba kasi nakikita natin mga symptoms. Ano nga ba symptoms na pwedeng makita pag halimbawa chronic fatigue? Halimbawa, if you want to diagnose a person na, chronic fatigue syndrome, ano yung mga kadalasang sintomas na makita mo or ano yung mga na-encounter mo sa wellness center?
Usually, patients will complain of fatigue kahit na enough or kompleto yung tulog.
Okay.
Tapos, parang may tinatawag kasi na post-exertional crashes, no? Yung simpleng routines lang or simpleng gawain lang. Parang wiped out na sila kagad. Oo.
Pwede nakakapagod na yun.
Oo, parang like kunwari, simple things like going to class or even socializing. They feel the effects of it for days and they feel wiped out after. Tapos, parang may mga associated symptoms na rin. Like kunwari, headaches, body aches, generalized body aches, or they feel lightheaded when they stand up. Yung mga ganun na parang usually we take for granted. Diba? Pero, yun yung mga typical na red flags.
Right. Doc, then, di ba ngayon parang sinasabi natin pati yung anxiety, yung depression, parang tumataas din siya. Pwede rin ba yung symptom ng chronic fatigue?
Oo naman. Kasi di ba, parang if you compare yourself with maybe other people within your age group, or if you just compare yourself how you are now versus maybe several months back, makikita mo yun yung parang difference in functionality.
Okay.
So, usually ganun yung mga tanong sa akin ng patients, Doc, bakit nung like, just a year or two ago, kaya ko pang umakyat ng LRT. Ngayon, parang hindi na.
Hirap na,
parang
hirap na siya.
Tapos parang pagod na ako, ayoko nang bumangon para mag-attend ng class.
Right.
I feel different. It feels bad. Parang ganon. So, nagkakaroon na ng mga anxiety, depression because of that.
So, parang layers talaga, no? Nagpapatong-patong tuloy yung mga sintomas na nararamdaman.
Tapos dahil normal yung labs, minsan, parang lalo silang nagse-second guess.
Lalo
diba?
nakaka-anxious yata yun, di ba? Kasi parang ang sama-sama ng pakiramdam ko, pero normal lahat nung lumalabas.
Yeah.
Sige. Doc, then, siguro ngayon, di ba, like in functional medicine, sinasabi natin root cause. Tinitingnan natin yung dahilan, bakit ito yung nararamdaman, or why you feel this way. Let's talk about the mitochondria. So, medyo nerdy ng konti, no? Can you describe bakit importante yung state of the mitochondria when it comes to conditions like chronic fatigue? Kasi pang bio lang natin yun. Tama po ba sa mga students natin ngayon? Biology natin na-encounter yung powerhouse of the cell.
Well, I'm hoping that more and more people get enlightened and empowered about this. No? Kasi yun nga, yung common na iniisip ng mga tao, porque hindi nila nakikita, porque nasa cellular level, molecular stuff. Parang pang-expert lang yan. Hindi, dapat ganun. Right. So, we talk about the mitochondria because they're basically the batteries of our body. So, di ba yung katawan natin, we're made up of organs and tissues. all of our organs and tissues are made up of cells. Tapos yung mga cells, merong mga baterya. Yun, yung
Kanya-kanyang
mitochondria.
baterya.
Oo.
Marami yun, di ba, sa
Yes,
bawat cell.
oo.
Hindi
So,
naman isang baterya
yes,
lang, di ba?
oo. So, every cell has mitochondria. And the mitochondria, that's what turns the food that you eat and the oxygen that you breathe into energy or yung tinatawag na ATP. No? So parang when someone has chronic fatigue, 'di ba? We don't just ask why are they tired. We also ask why aren't their batteries or their mitochondria holding a charge?
Hindi
Diba?
ko nare-recharge.
Bakit kulang sa volts yung baterya mo?
Oo nga.
So, yun. So,
Wala silang charger, Doc, din?
parang nauubos yung ano nila, 'di ba? Parang kunwari yung 'di ba sa cellphone, merong tinatawag na low power mode. So, parang kahit na i-charge mo overnight, parang hindi na umaakyat hanggang 50-60% na lang. So, yun, sometimes the chronic causes or stresses parang interfere na with the recovery and the charging.
So, Doc, din ang question ko, kasi di ba, like, yung iba, like, matutulog ka plus recharged ka na. So, meron ba tayong mga habits na maaaring that can actually explain why your mitochondria and the energy you generate is very poor or not working.
Diba? Sometimes we overlook actually yung overexposure natin to light. Kasi 'di ba pag bedtime, ideally talaga madilim na yung paligid mo. Pero
iba may night light.
Oh, yes. Night light. Or parang 'di ba just looking at their phones and getting all that blue light from the gadgets that actually interferes with the normal secretion of certain hormones and metabolites like your melatonin that helps you regulate your sleep better. Or so yung light, pag too much light exposure, or sometimes even little things like kunwari yung environment mo. Alam ko kasi si Doc Jello, 'di ba? Environmentalist yan.
Ay nako, expert talaga sa environment si Doc Jello.
'Di ba? Pero ito yung mga simpleng things lang in the bedroom environment like is the temperature okay or conducive for sleeping, or baka mamaya sobrang daming clutter and abubot dun sa bedroom tapos gathering dust tapos hatching ka na ng hatching, nasally congested ka na. Even that by itself can already interfere with your oxygen.
Right.
Diba?
So
Diba?
pati yung
So
parang
you can wake up
lagi
tired.
sa gabi. Pag may mga allergies, gano'n, no? Oo.
So little things like that we often overlook, di ba?
Right. Doc, then pwede rin ba, halimbawa, yung pagkain natin, meron bang connection to sa energy? Alam mo naman kasi, ano bang usual diet din ng ating mga
estudyante,
kabataan? Actually, pati adults, di ba?
Oo eh. Well, usually, yung mga convenience food items kasi, unfortunately, they might not be as replete in the, nourishing nutrients. Tapos, a lot of the time pa, maraming mga asukal. Maraming mga...
Masama ba asukal, Doc, din sa mitochondria?
Ano kasi, yung parang yung spikes, dun sa yung sugar spikes can also affect how your body processes the energy.
So, meron bang recommended na dapat ito yung kakainin mo, para matulungan yung mitochondria?
Okay, so medyo yan, parang case-to-case basis din talaga yan. You do what you can. You do what you can, where you can, with what you can. Ideally talaga, you have to have a lot of the colorful plants in your diet. You incorporate a lot of those kasi yung mga kulay dun sa pagkain na yan, mga gulay, mga prutas, they provide you with yung mga tinatawag na phytonutrients, antioxidants that also help your cells not age faster.
Oh,
diba?
So important na hindi nag-age yung cells. Ganun ba yun, Doc, din?
Sana, parang gano'n. Parang may kind of protective environment sila. Kasi, di ba, your cells make up your tissues and organs. So, if your cells have dysfunctions or imbalances, it starts affecting the organs and tissues later.
Right. Or kumbaga siguro sakto lang, 'di ba? Nagsa-cycle yung mamamatay sila, may autophagy, pero may bago tsaka mas malakas na mitochondria din na na lumalabas.
Oo. Tapos one way that you can actually cultivate more mitochondria is, you exercise.
Okay.
Your muscles contain more mitochondria. Tapos kasi yung organs sa katawan that actually need more mitochondria are your brain, your heart, your liver, your muscle. So parang ano na yun, patong-patong na yun, di ba? If you exercise, you remind your body that, hey, I have muscles. Diba? Parang it's kind of like preparing your body na rin for better focus. More
Tama.
energy.
So,
diba?
Doc, then maganda yun, no? So, anong mangyayari? Halimbawa, walang energy ang liver. Kasi sabi mo, ano nga yun? Brain, yung heart, yung liver,
yung muscles.
Kailangan nito ng ng energy galing sa mitochondria natin. So, ano yung mararamdaman mo? So, napag-usapan natin, brain medyo. Diba? Pag liver, bakit ba importante yung liver natin?
Yung liver kasi yung isa sa mga tinatawag na detoxifying organs ng katawan. Di ba? Parang when you eat food or when you breathe in something, anything no, that you expose yourself to, the liver is one of the first organs that will parang separate the good stuff from the bad stuff in your body. So without the liver, parang kumbaga, toxins can build up in your body. No? And that can lead to more inflammation. So, yun.
So, parang, kumbaga, cycle siya. Nagtutuloy-tuloy yun. No? Pagkulang din yung energy na kailangan ng liver natin. So, Doc, then, parang siguro tanong ng ibang listeners din natin, ano, parang, sabi nyo, minsan, pag nagpagawa ko ng labs, wala namang parang significant na results na nakikita. So, kailangan ba ako magpa-labs? Yun siguro yung tanong nila. And kung kailangan ko magpa-labs, ano yung mga labs na might be most useful, let's say, for a clinician like you?
Okay. Yung mga basic na labs kasi, like kunwari yung CBC, yung CBC, complete blood count. Okay? Sometimes, if the numbers in the CBC fall within the reference range. Yung automatic na response is, oh, normal naman eh. There's nothing. There's no disease. There's nothing wrong. Pero, from a functional medicine perspective, meron din kasing mga tinatawag na optimal ranges.
Ano yung optimal range
yung mga,
na yan?
Sometimes, they can fall within the normal. Pero kung kunwari, nandun siya sa lower range of normal. Tapos, mako-correlate mo sa symptoms nung pasyente. That's something that you can work with already. Tapos minsan, 'di ba, we take for granted, usually tinitingnan natin sa CBC yung hemoglobin lang, yung hematocrit lang
or WBC.
O WBC, o malalaman mo kung may infection, kung anemic, yun na yun. Pero merong pang ibang parts dun sa CBC yung tinatawag na red blood cell indices. No? So sometimes yung results nun can already let us know if the patient is lacking certain nutrients like B vitamins, which are important for healthy red blood cell production. So, yung ganun, di ba? Tapos pag titingnan mo yung physically examine mo yung patient, minsan, meron na ring mga telltale signs ng mga micronutrient deficiencies. Like, kunwari, parating nagkakasugat dito.
Parang
tuyo yung gilid ng lips. Or kunwari, pag titingnan mo yung dila, parang ang laki-laki. So, sometimes those are already signs of micronutrient issues na not necessarily abnormal pa sa labs.
Tama. So kumbaga, what you're trying to do is actually look for patterns. Tama ba,
yes,
Doc Den?
yes, patterns. Oo.
And if you have yung training, kagaya ni Doc Den, you can like...
And Doc TP.
and connect the dots, di ba? Yung sinasabi mo lagi, yun ang ginagawa mo, di ba? Sige. Pero Doc Den, ang question din is, why do like many patients feel parang
exhausted?
Exhausted sila talaga. They're so tired. Pero normal. Madalas, like halimbawa, sa dami-dami ng pasyente na nakita mo, marami ba ganun pa rin? Or yung iba meron talagang some signs ka nakikita?
I think, pag parati kang nakakakita ng ganun, minsan mas madali mo nang ma-recognize yung mga patterns na yun eh. Pero syempre, ano rin yun, you really also need to take time with your patient and slow down the conversation a bit and ask them stuff that typically they might not even think of or parang take for granted. Like yun, kunwari, parang ano yung typical na kinakain mo for breakfast.
Right.
So if kunwari it's a lot of carbs or maybe fast food, di ba, mabilis yung spike ng energy doon, pero mabilis din yung crash. Pero kung kunwari dagdagan mo ng more protein like eggs or sardines, ganyan, mas steady yung release ng energy mo throughout the day. So pwedeng mas sustainable yung energy levels mo that way.
Right.
Or yun nga, yung like taking the example of sleep, 'di ba? How erratic is their bedtime? Do they worry about things before they settle down? Do they get to gather themselves?
Correct.
Those things,
O, nag-email pa sila,
Or
sumasagot
nag-email pa
ng
sila,
trabaho.
parang sa bedroom,
Oo.
dala-dala pa nila yung work nila.
Oo nga,
So
right.
yun.
Pero
Sana, no?
Doc, din gusto ko yung sinabi mo kanina, no? Parang may sinabi ka na kailangan mag-slow down even during the consult. Siguro, can you give us, like, what will happen in a typical consult with a functional medicine specialist? Ano yung slow down na na-mention mo kanina?
O yun. Kasi parang, instead of just, kunwari, reaching for a prescription and writing down, some medicine right away, di ba? We have to ask talaga, why is the body running low on energy in the first place? So, it might be things that we often miss, like, how well is your body actually absorbing the food that you eat? Baka mamaya
so,
pala
hindi pala
kasi
enough na nutritious food yung kinakain.
baka mamaya pala kasi may mga, 'di ba, mga gastric issue siya. Tapos hindi pala niya talaga na-digest ng maigi yung food niya. Or it might not just be the kind of food that he eats, 'di ba? It might be the absorption.
Right.
Or are there any particular stresses that keep them in survival mode all the time? Like yun pala, kulang pala
Fight
sa
or flight
parating
mode
fight
sila.
or flight, 'di ba? Yung ano tawag doon, yung isang
Sympathetic.
parang parating
Elevated yung sympathetic
elevated yung
nervous
stress
system.
response nila, 'di ba?
Right.
So pag
Oo.
ganun, mas madaling maubos yung mga nutrient reserves ng katawan. So syempre mas madaling ma-drain. Tapos yun nga, things from the environment that can quietly drain your energy.
Right,
Like,
right.
kunwari, meron ka bang kapitbahay na nasa construction? Tapos,
Maingay pala yung kapitbahay
maingay
mo.
sila. Or kaya parang nagkakaraoke the whole night or nalalanghap mo yung mga fumes from the paints or the solvents.
Right. Or naninigarilyo yung kapitbahay mo.
Yes, oo. Or like yun, yung mga like, kunwari, like the nightly,
Inuman.
beer, di ba? To help you supposedly relax. But not
okay.
really.
Tama.
Diba? So,
Doc,
ganon.
din ang ganda nung parang, di ba ang title nga ng show natin is Conversation. So, I think yun yung sinasabi din ni Doc din, di ba, na importante to have these conversations with your health practitioner. Kasi, and for us doctors din, yung parang, ako nga minsan parang feeling ko chismosa ako na parang, tapos, anong nangyari sa nanay mo? Yung yaya, kamusta ba? Kasi di ba syempre mga kids naman yung patients namin, no?
Oo. Parang pag ganun, we have to be more intentional. Kasi sometimes, tas yun, yung experience ko, some of the patients, they will say, alam mo, Doc, you're one of the few doctors who have ever asked me that question. I find it very refreshing. Kasi, parang sila rin, yung parang na-realize nila, nga, no, parang these things don't always show up on the labs.
Right.
But they, di ba, they're valid and they affect how the person feels. So,
Doc Den, ako, naging pasyente po ako ni Doc Den. And natutuwa po ako na parang one of the questions na lagi niyang tinatanong will be, kung nasaan na yung pasyente and meeting them where they're at.
Yes.
Diba? Parang this is a common question na tinatanong ng mga functional medicine practitioners natin. Gusto mo bang elaborate yon, Doc Den? Bakit niyo ba tinatanong yun sa amin pag nagpapakonsulta sa inyo? Anong importance naman nun?
Parang, kasi 'di ba, lahat naman tayo, we all want, well, as doctors, 'di ba, we want our patients to we want to empower our patients to also take back their health. So it's not just being dependent on the doctor who's prescribing the drugs, no? Parang outside the doctor's office, of course, they also need to feel like they can do stuff to get themselves better. So, that's a very valid question na nasan ka ba sa health journey mo? Kasi iba-iba tayo eh. Merong ibang mga patients na yung level ng pagod nila, the only physical activity that they can do is really just put on their sneakers, walk to the door. That's it.
Pagod na, hinihingal na sila.
Oo. Pero, at least may ganun, di ba? Meron namang ibang mga patients na hindi masyadong makakain, kaya obviously, kulang talaga sa energy. So, you have to work with that first, yung parang getting them to eat better.
Right.
So
pati yung relationship with food, ini-examine mo din, ano?
Oo. Iba-iba yan eh. So, parang it's yung mga dekahon na kunwari, low salt, low fat. what is that for the patient? For all you know, 'di ba, yung low salt pala for them would mean not eating canned goods for breakfast. Diba?
Oo
So, diba
nga.
yung ganun, diba? So,
Oo nga, Doc, din.
yun.
Pero ang ganda nun. So, parang what you're saying din is you're personalizing your approach
Yes, oo.
towards
That
the
would be
needs
better.
of this patient. No? And when you personalize, it's not necessarily ordering the expensive labs.
Yes.
Diba? Kasi
Yes.
minsan yun yung impression nila about functional medicine, Doc.
Puro
din.
supplements, puro labs.
Puro supplements,
hindi.
ang daming supplements. Ang mamahal ng labs.
Oo.
Parang gusto ba mag-comment
it's the
tungkol
approach.
dyan?
Functional medicine is really an approach. So it's not supposed to be a specialty. If it were up to me, dapat lahat ng med students natin marunong sa ganyang approach.
Yung lens na ginagamit nila.
Parang it
no?
can reach more people. And kasi parang ngayon kasi, 21st century, despite all the labs and the specialties and the technology, the rate of chronic disease, non-communicable disease is still increasing. So there has to be a different way of approaching things, 'di ba?
Right,
Para
right.
hopefully yung global burden ng disease
At saka baka yung
bumaba.
mga techniques that we've been using before might not be sufficient.
Applicable or
for-
sufficient, yes.
For the
Oo.
non-communicable diseases.
Yes, oo.
Doc, Den, punta tayo dito. Ito yung portion na medyo
kinakabahan
na-excite ako.
Oh
Ito
my
yung
goodness.
fact or myth
Oh,
na
no.
portion natin. Mabilis lang to,
Oh,
Doc
sige,
Den.
okay.
Game ka ba?
Ready.
Ready.
Okay, ready.
Ready, okay.
Ready.
So ito, being tired all the time is just a normal part of getting old.
Oh, myth.
Tumatanda na ako.
Myth
Fact or
yan.
myth ba yan, Doc?
Myth
Den?
yan.
Myth yan? Bakit siya myth?
Well, our energy levels change naman talaga, di ba?
Right,
But,
right.
but the chronic exhaustion that stops you from enjoying life,
Okay.
that's not a normal part of aging.
So,
Okay?
kailangan nag-age ka, pero nag-enjoy ka pa rin.
Oo. Parang yung mga ganun, that's already a sign that your mitochondria need support. Kasi, we have patients who are, di ba, kunwari ikaw, if on your next birthday, someone will ask you, Doc TP, Doc, how old are you? Oh, I'm like that. But, I still feel like I'm 30.
Oh,
Diba? Diba?
I feel like I'm 30. Yeah,
So the fatigue should not stop you from enjoying life.
Yeah, the things that you like to
Yes.
do even when parang years or decades ago, no?
Yeah.
Sige, so myth yan.
Myth yan.
Okay, myth. Ito naman, Doc Den. So, if you're exhausted, you just need more caffeine. Kailangan ko lang damihan yung kape ko, yung energy drinks ko to kickstart your system. Fact or myth?
Myth.
Myth
Din yan. Your caffeine, parang para kang nangungutang na sobrang taas nung interest nung load mo.
Oh my gosh.
Kasi you pay
5, 6, ganon.
You pay for the energy later with the interest. And especially if you over-rely on the caffeine or the energy drinks, no, it can actually
Right.
stress your mitochondria further because, like coffee, can also interfere with the absorption of certain important minerals, like your
Right.
magnesium that helps you relax, or your
Okay.
calcium that helps build bones, no? Or,
Okay.
anong tawag dito? Not to mention, parang pag sobrang
Minsan
na yung caffeine mo,
sinisikmura ka
sinisikmura
diba?
ka,
Pag
oo.
gano.
Or parang yun nga, yung hindi ka nakakatulog ng mahimbing, which is actually very crucial
Right.
for the body's recovery.
Doc Den, paano yan? Halimbawa ko nakakalimang. Di ba may mga kakilala dito nakakalimang tasa, yung malalaki, 5 tasa ng black coffee. Ano gagawin nila? Are they like stuck with that 5 cups of black coffee? Meron ba pwedeng gawin for that?
For me, I also ask them what they can at least do to reduce the intake. Kasi pwede namang ganun sige, so kung nakakalima ka ngayon, would it be too much effort to maybe limit it to 4 and then to 3 later, or if you want maybe yung 2 last cups of coffee mo, imbis na coffee, gawin mong green tea or gawin mong salabat, or would that be doable for you? We just do what they can first. Kasi parang if you're the doctor dictator, wag ka na magkape. Parang sabihin mo pa
Parang
siya,
imposible naman yan.
naman
Ito na yung happiness ko
diba? Parang gano'n.
Oo.
But as much as possible, you really want to not be exposed to the coffee or the high energy drinks beyond like 2
Anong oras?
p.m.,
2
ganyan.
p.m.
Kasi
Okay.
merong ibang mga tao, mga slow metabolizer sila ng coffee. Minsan, nagsistay yan sa katawan mo until bedtime.
So, mas lalo sila hindi makatulog, no? Tama. Doc, din, di ba, uso din, so, ngayong kape yung pinag-uusapan. Lahat tayo, marami sa atin mahilig sa kape. Ano naman yung tingin mo dun sa, di ba, uso mga 3-in-1 na coffee, di ba? So, alimbawa, kailangan kong magtrabaho sa gabi. So, meron akong 3-in-1. Or kailangan ko may exam ako bukas. 3-in-1 yung bubuksan. Ano bang better? Better ba na mag 3-in-1 ako kasi masarap versus black coffee? Meron bang pagkakaiba yun?
Usually kasi yung 3-in-1, marami ng mga asukal yun eh.
Asukal more
Diba?
than coffee
More than
na,
coffee,
no?
oo. So, sometimes that might make things worse. Versus say, like at least yung brewed na coffee, pwede mo pang i-dilute yun.
No, okay.
Diba? Tapos alam mo kung ano yung laman.
Natural din, kumbaga, coffee beans galing.
Between the two, parang mas preferred ko yung
black coffee. Okay, pero sige, tatandaan po natin yan. Dahan-dahan natin yung
Dahan-dahan.
bababa. Okay, kasi kailangan sustainable doc din, di ba? Kundi, hanap-hanapin ko pa rin yan. O sige, ito na, next. A standard multivitamin is enough to fix chronic fatigue. Fact or myth?
Myth.
Myth din.
Myth pa rin yan kasi...
Daming myth,
Oo nga eh.
Okay.
Hindi kasi yung mga vitamins, kumbaga, parang mga spark plugs lang yan dun sa katawan mo. Yung engine mo
Sa
kasi,
kotse mo,
yung chan, yung gut, or kunwari yung communication system mo, yung hormones, yun yung engine. So yung vitamins, parang mga spark plugs lang yan. So kung sira na yung engine, hindi makakatulong masyado yung vitamins mo. No, you need a more
Anong kailangan gawin?
root cause kind of approach. So
Okay.
parang first, you have to dig deeper. Diba? Find out what's causing the engine trouble.
Okay.
Diba? Parang ganun.
So, hindi pwedeng, sige, kukuha na lang muna ako
Oo, ng pang-ano. Although, I'm not saying that vitamins do not have benefits. Kasi, meron talagang matutulungan yan. Like, yung mga patients na talagang nutritionally deficient.
Oo, wala na, empty gas tank na sila, so makakatulong siguro.
Or hindi talaga nakakakain ng mahusay, yung mga sobrang restricted yung diets kasi daming allergies. Or sometimes, or like even for pregnant women, di ba, they're feeding, more than one person. So,
right.
yun, sometimes you really need additional nutrients or supplements. But it has to be guided kasi sobrang usong-uso ngayon, 'di ba? Porque makita mo lang sa social media.
Yung kapitbahay ko nagte-take ng ganito.
O yung kaibigan ko, ito yung ganyan. Tapos magte-take na rin sila pero iba-iba kasi talaga tayo ng parang biochemistry and need. So
Doc, din, so pwede mo rin i-personalize yung mga vitamins, yung supplements na tinitake?
Oo.
Okay.
Like sometimes it can be as simple as, kamusta yung routine mo? Hindi ka ba naaarawan? Baka yun pala vitamin D deficiency lang.
Kulang ka pala.
Oo, pero parang yung multivitamins kasi ang dami ng mga stuff na maybe you don't really need.
Naku, kailangan
So,
pala
it
meron
really
tayong
depends.
episode on supplements din dito. At marami kasi nagtatanong, kailangan ko ba yan? Or nakikita ko nga, di ba? Sige, okay. So, yan yung mga multivitamins natin. Ito, meron ding tanong dito, Doc, din, no? If you're suffering from chronic fatigue, you should avoid all exercise. Fact or myth?
I would say it's mostly a myth. Like for instance, you shouldn't run a marathon or do very high intensity workouts if you're crashing, 'di ba?
Okay.
Pero
Yeah.
gentle movements, like mindful movements, like walking or stretching, no, that actually reminds your body to make more mitochondria.
Okay.
Kasi if you think about it, the extra movements, lalo na if you combine it with breath work, no, parang yan you're giving your body more oxygen. You're opening up the blood vessels for circulation, for the nutrients to flow to the different parts of the body that need it. So when it's like that kind of movement, that's good.
Right.
Versus say, pagod ka na, pero parang the whole day.
Oo.
Lalong magsa-stagnate yung mo, di ba?
Oo, yung
Katawan mo.
energy. Tsaka siguro yung muscles mo lalo liliit,
mag-atrophy,
mag-atrophy yung mga muscles natin, no? So, ayaw din natin yan.
Yes.
Okay. Tapos, sige. So, sinabi natin. So, parang, Doc din, so, meron bang particular types of exercise na pagod na nga ako Lakad ba enough na yon?
At the start, if that's what you can do, I think that's a good thing.
Okay. So, kailangan mo rin i-personalize din.
Or parang yun nga, parang kasi yung movement naman, even like house chores, or even playing with your pet. That's still movement.
Correct.
And,
Or with your children.
Yeah, with your children. Yeah, oo. That's still
Sige.
movement.
Okay, so tatandaan natin yan. Ito, and this question is dedicated to Doc Jello, who's not here right now.
Hi,
So,
Doc Jello.
ang chronic fatigue can be caused by environmental toxins. Fact or myth?
That's a fact.
Yon, may isa tayong fact dito, mga kababayan. Yes.
Pero baka
Bakit
dapat
siya fact?
may episode din tayo na si Doc Jello yung guest speaker
Oo
kasi
nga.
siya yung expert.
So, parang environment
No?
and the mitochondria and
Oo.
fatigue.
Kasi yun nga, di ba, as mentioned earlier, we're all made up of our genetics, our lifestyle, and our environment. It all comes together.
Right.
So, whatever exposures you have, the body can assimilate that. And then, if it's mga, kunwari, heavy metals, like arsenic,
Yeah.
or yun nga, yung mga
Cadmium, yung mga nasa kanin daw natin.
Yes,
ano?
di ba? Yung mga chemical fumes, di ba? That actually takes more work for the body to process and detoxify.
Okay.
So that can, slowly drain your body of the nutrient reserves na technically dapat ginagamit for rebuilding, not like getting rid.
Oo.
Diba? So,
Right. Oo.
yun, oo.
So, maganda na, okay, talagang cycle and putting back the balance sa body, yun yung importante when we talk about chronic fatigue.
Yeah.
Doc, then, pag-usapan naman natin yung conference natin sa February 6 and 7.
okay.
So, I know you're heavily involved in education, lalo na sa ASMPH, no? Tapos, yung conference natin is entirely on energy and the mitochondria. And shout out po tayo kila Doc Aiza, kay Doc Tin, Miss Chrissy, ang ating mga organizer sa conference. Malapit na po. So, bakit naman natin na pag-isipan to dedicate this big conference na ang tutok natin talaga yung mitochondria at energy? Bakit tingin mo mahalaga na mapag-usapan natin to ngayon?
Okay, kasi, 'di ba, lalo na in the healthcare field. And when you teach medicine, 'di ba? You start to see patterns na almost every non-communicable disease or chronic health concern that we deal with today, from fatigue to memory issues to metabolic issues like diabetes and obesity to immune conditions like cancer or autoimmunity, 'di ba? Even accelerated aging. Ano yan they all have something in common. And that's, these conditions, they develop depending on how well our cells also function and produce energy.
Oh,
Diba? And so
okay.
that comes back to the mitochondria.
So parang related pala lahat.
Oo, kasi yung mitochondria, hindi lang naman yan just about feeling energetic or ganyan, di ba? The mitochondria actually influence how we think, how we heal, how we respond to stress, and how resilient we are in the long term. So if energy production is compromised,
Right.
everything else in the body will struggle to keep up. So that's why. That's why.
Kaya pala maganda siyang pag-usapan talaga. Parang whole body pala yung ano. And minsan hindi kasi natin iisip yun Lalo na mga estudyante, di ba parang, ito yung
masyadong
memorize ko
biochemical
dati.
naman
yan. Oo, ganyan.
Yung Krebs cycle, yung electron transport chain sa ating mga YL5 students sa Ateneo.
Parang
diba?
sobrang highly specialized naman ng topic na yan. Pero hindi, what we want for the audience and, the conference participants to realize is, it's not actually very niche.
Oo. Or
Ano yan?
detached
Or
from
detached.
their,
Oo,
diba? Yung-
everything is connected.
Correct.
Oo,
Dun sa mga
so-
symptoms na nakita nila or yung mga patients that they treat. Actually, nagkakwento nga, one of the organizers, kausap ko, parang sabi daw ng ibang doctors, parang ang tagal-tagal ko nang inaral yan. Bakit yan importante na pag-usapan ngayon, no?
Yes.
And I think yun yung isa sa mga advocacy din natin.
Yes.
To bring it to their consciousness, to our consciousness, na, this is something we need to pay attention to, no?
Tsaka kasi yan di ba? Di ba naalala mo nung med school, usually naman sa med school, yung first couple of years, it's really about trying to understand how the body works, di ba? So yung
Right.
anatomy, physiology, biochemistry. Tapos, the rest of the meds training, parang it's all about identifying what the disease is, what to treat it with. So parang minsan nalilimutan natin yung foundations. So parang yun. 21st century
Magandang
na
balikan
tayo,
siya.
di ba? O kailangan
Yes,
balikan.
yes.
Kasi para mas wide yung
Correct.
lens natin.
Parang in the same way nga na puro dumalabas na ang AI, ang technology, everything is also going molecular, 'di ba?
Oo,
Parang root cause, molecular, mm dahilan bakit ganito.
Yeah.
Maganda.
So we
nga
want
siya.
this to be an eye-opening, empowering conference.
Wow! Yeah. Ganda na. At so, iniimbitahan po namin
Mitochondria.
kayong lahat na mag-attend sa aming conference ngayong February 6 and 7. Siguro, ipopost na lang natin dun sa ating Facebook page yung poster natin. So, babalik ako sa chronic fatigue, Doc
Okay,
Ben.
okay.
Kasi, chronic nga siya. Pwede pa ba itong i-reverse? Halimbawa, di ba, may iba sa mga patients that we meet parang months or years na sila
oo.
na pagod na parang they're stuck in that hole. Meron
Yeah.
bang way na ma-reverse pa ba to or lifelong condition na ba ang chronic fatigue?
No, that's not a lifelong condition. It's very possible to reverse it. No, but also recognizing that, 'di ba, in life naman, wala naman talagang straight path towards healing. So, we also have to keep that in mind na as we journey through life, meron talagang ups and downs, may plateaus, may valleys. Pero, yun nga, parang it's really about, discovering more about yourself.
Right.
So that,
Oo.
and being intentional about it, no? Discovering what works for you, what doesn't. Para you're more empowered to, prepare for things.
Right.
Diba? And,
Oo.
Yeah.
At saka yung sinabi mo na being able to bounce back, yung resilience, di ba?
Oo,
Kasi parang
oo.
hindi naman natin may iwasan talaga ang adversity, yung mga situation na we're exposed to,
Yeah.
yung mga
Oo.
life events.
Oo, kasi
na
minsan,
nangyayari.
lalo na yung sinasabi nila sa mga Pinoy, lalo na, matiisin talagang mga Pinoy. Which
Oo nga.
sometimes,
Sobra na ba?
sometimes to a fault, di ba?
Oo.
Kasi if it's like maybe government-related stuff, that's different. But,
Sandali.
Okay. Pero anyway, sige, going back to that, di ba? Yung sinasabi talaga nila, matiisin talaga ang mga Pilipino. Pero, sometimes, we tend to ignore, no? And that can also be bad kasi what if the body just suddenly decides na, you have to stop. And then it's because you're already having a very bad migraine or a heart attack or a stroke.
Aantayin mo ba?
Aantayin mo pa ba
Oo.
yun? Hindi. You have to listen. These signals, no, yung like chronic fatigue, ganyan, and pervasive exhaustion, these are signals. You have to listen to it.
Ang ganda
So,
naman
yun.
yan. We really need to listen to the signals that our body is giving us. No? And alam mo, minsan naiisip ko nga, di ba, like, a lot of us then take care of people who are sick. And minsan yung mga caregivers na rin natin, parang sila yung nakaka-experience ito. Meron ka bang mga patients na ganyan, pati yung caregivers exhausted na.
na
and
sila
ano,
din.
no?
Oo. Yes, oo. Kasi yun nga, nakikita nila, di ba, they empathize.
Yeah.
And yun. But it's also telling them to give themselves the grace to, and this I learned also from one of our functional medicine mentors, diba? It doesn't mean that, no one naman is perfect and, life isn't perfect. But you have to give yourself that grace to,
Ang ganda naman
and space.
Yan.
So, parang,
tama.
Oo.
Yung grasya po, importante. That space, that time then, to
Yes.
make time for yourself, to
Yes.
rejuvenate and build the energy, no? Ngayon, Doc, then, siguro pag-usapan natin, kung halimbawa, maglalagay lang ako ng konting tips dito. Halimbawa, meron kang habit na gustong i-start to protect the mitochondria. Ano kaya yun?
gosh, that maybe some of the more simple things I can think of is like yun. You try to align yourself with the sun. No, yung parang
sabayan mo?
sabayan mo,
Pag
'di ba?
umaraw.
Paaraw ka rin. Hindi kasi ang laking factor nun,
Totoo,
vitamin
totoo.
D. Ang dami
Yes.
dito sa Pilipinas, vitamin D deficient kasi
Di ba ironic
hindi
yun? Napakainit ang dami nating araw.
Oo,
nga.
so that's one. Another is, yun nga, I think we were also talking about it earlier before the show, di ba? We have to be intentional about just tracking our responses. Like, kunwari, for this particular day, kamusta yung energy levels mo? Ano ba nangyari ngayong araw? May kinain ka ba na kakaiba? Or natulog or puyat ka ba the night before? Or, and looking for patterns.
Yes.
Kasi iba-iba talaga tayo per person eh.
Tama ka dyan, Doc, din, no? Sige, so actually maganda yung mga na-mention mo din na mga some tips. Pero meron pa ako, may magtatanong pa ako sa iyo, yung mga takeaway natin, magtatanong pa tayo dyan. Ako siguro parang, alam mo, like ngayon, di ba marami rin sa atin, and ito yung perspective ni Doc Jello, ang environment, pwedeng sa loob ng bahay may pollution din tayo.
Yes.
Diba? So kung meron tayong kamag-anak na nagsusmoke or nagve-vape, that's something na very doable. Tanggalin na natin from the environment. Yan yung ano. Tsaka syempre yung sleep. 'Di ba? Ngayon kasi ang daming nagpapapuyat sa atin. So, just tama yung sinabi mo, being intentional about it, Doc Den. Sige. So, Doc Den, malapit na maubos din yung oras natin, no? So, I would like to thank you for this enlightening conversation.
I enjoyed this.
Yes, sana maulit ang iyong pag-guest dito sa Cura. And ang nakakatawa pa dito, yung ganitong kinds of conversations really change the way we look at our own energy. Kasi maraming insights. Minsan parang kahit one word lang na sinabi ni Doc Den, parang light bulb moment. Oo nga, no? Parang ito pala yung ginagawa ko, or ito pala yung nangyayari sa akin. So, Doc Den, do you have like any final words for our listeners who might be feeling that slump in energy right now? Like, kung halimbawa merong isang bagay na gagawin nila bukas, paggising nila, ano yung tingin mo that one thing that can probably move the needle for them?
I think, di ba, a lot of our viewers and listeners siguro already are familiar with that saying, di ba, health begins in the gut. So, for me, it can really be as simple as just checking what you typically eat. And then, yun nga, parang yung sinabi nga ni Michael Pollan, di ba? Parang eat plants, di ba? Always in moderation, di ba? Not too much, yung ganon, parang
sakto lang,
di ba? So, tapos kung pwede, yung totoong pagkain.
Whole food
yan. So, that would be one of my main takeaways. We have to nourish our mitochondria. Kasi yun nga, ang health natin, hindi lang nagsistart sa gut yan. It actually also starts where energy is made. Diba?
Ganda ng pag-relate mo sa mitochondria.
Yan, diba? So, yan. So, you have to listen to your body's signals.
Ang ganda niya, no? Minsan kasi nakakalimutan natin. Kasi diba, ang bilis-bilis, we're not paying attention, we're not being mindful to these small things that we take it for granted, no? But thank you for reminding us, Doc. Then it's such a powerful reminder, actually. So, to everyone listening, your energy is your most precious resource. And ano po ibig sabihin nun? You have to protect it. Okay, so tatandaan po natin yan. And next Monday naman po, we're going to shift gears a bit. We're going to talk about our dental health and how you could take care of your oral cavity and oral health. Pero ngayong pong gabi, magpapasalamat po muna ako kay Doc Den. Maraming salamat for joining us tonight.
Thank you.
Ayan, so tandaan po natin ang mga bilin sa atin ni Doc Den. And until next week, recharge your batteries and take care of your spark. This is Dr. Tipi Sumpaiko Tanchanco, and from Cura, stay energized, Ateneo. Magandang gabi po sa inyong lahat.
Isn't just about medicine.
It's about care,
Community
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing,
Hope and health right here on
Radyo Katipunan 87.9 FM. Cura, your campus health companion where care meets conversation.